Your dog is desperately trying to tell you they're sick. Are you missing the signs? Dogs cannot tell you where it hurts. They can't say my stomach has been off since yesterday, or my back left leg aches when I get up in the morning, or I've been feeling exhausted in a way that doesn't match just being tired. They don't have the words. They don't have the concept of describing an internal state to another being and waiting for help. What they have is behavior, and the only thing they can do when something is wrong is change. The problem is that most of those changes are subtle. They look like just having a bad day. They look like getting older. They look like being weird. And because dogs are extraordinarily good at masking discomfort, an instinct that goes back to a time when showing weakness in the wild made you a target, the signs are often quiet enough that owners miss them for days, weeks, or sometimes months. By the time the problem becomes impossible to miss, it has often been building for a long time, and the dog was trying to tell you the whole time. Learning to read the early signals is one of the most valuable things you can do for your dog's health. Not to turn every change in behavior into a reason to panic, but to build enough awareness of what is normal for your dog that anything shifting out of that pattern gets noticed early, when most problems are still simple and treatable. Here is what your dog may be trying to tell you, and what each signal actually means. 1. They change how they eat or drink. A healthy dog with a consistent routine usually has a consistent appetite. They know when feeding time is. They're interested in their food. They finish what's in the bowl or leave a predictable amount. When that changes, when a dog who always cleaned the bowl starts leaving food, when a dog who was never particularly interested suddenly acts ravenous, when a dog skips a meal and then skips another, that's a signal, not automatically a serious one. Stress, a minor stomach upset, and environmental changes can all temporarily affect appetite. But temporarily is the operative word. A change that lasts more than a day or two, or that comes with other signals, is worth paying attention to. Water consumption is equally important and often more telling. A dog drinking significantly more water than usual, going to the bowl repeatedly, emptying it, seeming unable to get enough, can indicate kidney disease, diabetes, Cushing's disease, a uterine infection in unspayed females, and several other conditions. A dog drinking notably less than usual can signal nausea, pain, or depression. Because water intake varies with weather and activity level, you have to know what's normal for your dog specifically. But if you notice and it's sustained, it's a reason to call your vet. The trap most owners fall into is waiting for the dog to stop eating entirely before acting. By that point, the body has already been dealing with the problem for a while. The earlier signal, the subtle disinterest, the slower approach to the bowl, the food being sniffed and left, is the one that matters. 2. Their energy and movement shift. Every dog has a baseline. Some are high energy by nature, some are naturally calm. What you're looking for is not whether your dog is active or lazy in general, but whether they are more or less active than they usually are, and whether their movement has changed in quality, not just quantity. A dog who used to trot to the door when someone knocked and now stays on the bed and just opens one eye. That's a shift. A dog who hesitates before jumping onto the couch they've been jumping on for years. That's a shift. A dog who takes longer to get up from lying down, who seems stiff for the first few minutes of a walk before loosening up, who doesn't want to go downstairs the way they used to. These are shifts. That often point to joint pain, early arthritis, injury, or internal discomfort. The tricky thing is that these changes tend to be gradual. Owners don't notice because they see their dog every day, and each day is only slightly different from the one before. It's often a visitor, someone who hasn't seen the dog in a few months, who says, "Is he moving differently? He seems slower." That outside perspective catches what familiarity hides. One useful habit is to film your dog moving occasionally. A 30-second clip of them trotting toward you, going upstairs, getting up from a rest. Over months, if something changes, you have something to compare. Vets often ask owners to bring video because it is almost impossible to recreate a dog's natural movement in a clinical environment. Pain in dogs rarely looks like what we expect. It almost never looks like the dramatic whimpering of a dog in a movie. It looks like stillness, like caution, like a dog who used to meet you at the door and now meets you halfway. Catch the halfway before it becomes not at all. 3. They start hiding or conversely clinging to you. Healthy, secure dogs usually have a consistent relationship with space. They have places they like to rest, a general level of proximity to you that feels comfortable, a pattern of when they seek out contact and when they're happy to be across the room. When that pattern changes, it's information. Hiding is one of the oldest illness-related behaviors in domestic animals, and its roots are evolutionary. In the wild, a vulnerable animal is a target. Showing weakness around others, even pack members, could invite aggression or abandonment. So the instinct when something feels wrong internally is often to withdraw, to find a quiet, enclosed, safe place and be still, to disappear for a while. If your dog, who normally follows you from room to room, has started spending long stretches alone in a closet, under the bed, or in a corner of the house where they rarely go, and this is new, not their established preference, pay attention. It may be stress, it may be a temporary mood shift, but it may also be pain, illness, or fear that they're trying to manage by withdrawing from stimulation. The reverse is also true. A dog who suddenly becomes Velcro, following you into every room, needing to be touching you, unable to settle even when they used to be independent, may be seeking comfort because they feel unwell or frightened. The shift in proximity seeking is the signal, regardless of which direction it goes. Subscribe if this is giving you a new way to read your dog's behavior, because the next signs are the ones most owners miss for the longest. 4. They lick, chew, or scratch one area repeatedly. Dogs use their mouths and their paws to manage discomfort. When something hurts, itches, or feels wrong, even internally, the instinct to lick or chew the closest accessible point is powerful. It doesn't always mean the problem is exactly at the point they're targeting. A dog obsessively licking a paw may have an allergy affecting the whole body, or a joint issue higher up the leg, or anxiety. The licking is not always a map to the precise location of the problem, but it is a signal that something is creating enough discomfort that the dog is trying to address it with the only tools they have. Watch for a paw being licked until it's pink and raw, a spot on the belly, flank, or leg that's being chewed repeatedly, a dog scratching one ear constantly, a dog dragging their rear on the ground. Each of these has a range of possible causes: allergies, yeast infections, anal gland issues, foreign objects, skin infections, joint pain that refers sensation down the limb. But all of them warrant investigation. The important thing to remember is that a wound you can see is only one possibility. The dog licking the same spot for a week with no visible break in the skin may have something happening beneath it: an infection, a cyst, a joint, a tumor that can only be assessed by a vet. Don't wait for the skin to break before you act. The repetitive behavior itself is enough to justify a checkup. 5. They have accidents in the house or their bathroom habits change. House training is one of the most deeply reinforced behavioral patterns in a domestic dog. A dog who has been reliably house trained for years does not spontaneously start having accidents without a reason. If it happens once after a particularly long stretch between walks, that's understandable and probably nothing. If it starts happening regularly, or if the dog seems urgent and unable to wait in ways they weren't before, something has changed. Urinary tract infections, kidney disease, bladder stones, diabetes, Cushing's disease, hormonal imbalances, and neurological changes can all affect a dog's ability to hold urine or change the urgency of their need to go. Gastrointestinal illness, parasites, dietary changes, and inflammatory bowel conditions can affect bowel control. Before you assume the behavior is a training regression or acting out, eliminate medical causes. The same principle applies to changes in stool consistency, color, or frequency. Occasional loose stool after a dietary change or during mild stress is common. Diarrhea, or very soft stool that persists for more than a couple of days, blood in the stool, stool that's very dark or very pale, straining without producing anything, all of these are signals that warrant veterinary attention. Straining to urinate and producing little or nothing in particular can indicate a life-threatening blockage and should be treated as an emergency. These conversations feel awkward, and it is genuinely unpleasant to pay close attention to your dog's bathroom habits. but it is one of the clearest windows into what's happening inside them. 6. Their vocalization changes. Dogs have a vocal baseline just like they have a behavioral one. Some dogs are talky. They bark, whine, grumble, make commentary noises throughout the day. Others are almost entirely quiet. What matters is not the absolute level, but the shift from it. A dog who suddenly starts whining or vocalizing at rest, especially at night, may be in pain that they can manage during the day's activity, but not when everything slows down and there's nothing to distract from it. A dog who suddenly stops making the noises they usually make, who goes quiet in a way that feels heavy, not just calm, may be depressed, exhausted from pain, or experiencing cognitive changes. Older dogs in particular may develop canine cognitive dysfunction, a condition with similarities to dementia in humans, which can present as disorientation, altered sleep patterns, decreased interaction, and changes in vocalization, including barking at walls or at nothing, or seeming confused in familiar environments. This is not just aging. It's a medical condition that can be managed with veterinary support. Any sudden and unexplained change in how much or how often your dog vocalizes is worth noting. Context it with other signals. If it's the only thing, it may resolve on its own. If it's coming alongside other changes, it's part of a pattern that a vet should know about. 7. Their coat, eyes, gums, or smell change. These are physical signals, not behavioral ones, but they belong in this conversation because they're easy to check and often very informative. A dull, dry, or thinning coat can point to nutritional deficiencies, thyroid disease, allergies, or parasites. A coat that was always shiny and suddenly isn't, or that starts shedding excessively outside of seasonal patterns, is worth noting. The eyes should be clear and bright. Cloudiness, discharge, redness, squinting, or one eye being held partially closed can all indicate injury, infection, glaucoma, or systemic disease. Gums, which are rarely checked, are one of the fastest indicators of serious illness. They should be pink and moist. Pale gums suggest anemia or shock. White or very pale gums are an emergency. Yellowish gums can indicate liver disease. Blue gums indicate a lack of oxygen and require immediate emergency care. The smell of a dog can also change with illness. Breath that becomes unusually foul beyond normal dog breath level can point to dental disease, kidney failure, or diabetes. A yeasty or musty smell from the skin or ears often indicates infection. A smell that's new and can't be explained by something they rolled in is worth investigating. None of these require a medical degree to check. They require 5 minutes and knowing what normal looks like for your dog. The point underneath all of this: your dog is not hiding illness to be difficult. They're not trying to make things harder. They're doing the best they can with the body and the vocabulary they have. And that vocabulary is behavioral. It is changes in appetite, energy, movement, location, vocalization, and physical appearance. Your job is to know your dog's baseline well enough that you can recognize when something has moved outside it. Not every change is serious. Not every soft stool is a crisis. Not every slow morning means the dog is dying. But the pattern of change, the persistence of it, and the combination of signals, those matter. The owners who catch things early are almost always the ones who know their dogs well and who take small changes seriously enough to call the vet and ask. Most vets would rather get that call and tell you it's nothing than have you wait 3 more weeks and come in when the window for easy intervention has closed. Your dog has been trying to tell you. Make sure you're listening early enough to help. Subscribe if you want to keep building the kind of awareness that keeps your dog healthy. The more you understand them, the earlier you catch what matters.